Good help and welcome to today's edition of the Welcome Watch. I'm your host, Dr. Michael Noor. A special guest today is Dr. Obi Nadeau. He is an infectious disease doctor in New Orleans. Today, we're going to discuss a program with a group of men with whom I have great respect. I'm working with 100 Black men, working on many areas. And one of those areas of health, one of those health areas is vaccinations. And that's what we're going to talk about today. Now, I know you've already made your mind up about vaccinations, whether you're going to get them or not. And all I want to do is to give you our side of it and give you some information that you can use as you make your decision about how you and your family are going to interact with vaccinations. For children here in California, we have almost no problem because it's the law, and you can't go anywhere without getting vaccinated. But across the country, children are still being affected. Adults are dying, especially disproportionately in the African American community. The 100 Black men, as usual, have taken on the tough task of talking to you about what's available now and why they feel that we should be dealing more effectively as a community, people of color and people in general, with these. And so before we start our discussion, I want to get some background. So let's go to the tape.
Let's talk about something real important today, our health. I know it's not always the most exciting topic, but it's crucial, especially with the RSV, flu, and COVID-19 still making the rounds. We need to stay on top of our game. Here's the deal. Vaccinations aren't just about you. They're about protecting our entire community. When you get vaccinated, you're not just shielding yourself from the virus, you're also protecting your family, your friends, and everyone you come into contact with. Think about that for a second. The 100 Black Men's Risk Less program is here to make sure we all stay safe and informed. They're providing resources, answering questions, and giving you the support you need to make the right choices for your health. I get it. There's a lot of misinformation out there, and it's easy to get confused or feel hesitant. But trust me, these vaccines have been thoroughly tested and are proven to be effective at keeping us safe. It's all about looking out for each other and making sure we're all here for the long run. So, if you haven't gotten your shots yet, now's the time. It's a small step that makes a big difference. Let's show up for ourselves and our community. Get vaccinated against RSV, flu, and COVID-19.
Well, Dr. Nadeau, that's just an overview of the issues we're going to talk about. Tell us a little bit about the 100 Black Men and 100 Black Men's Vaccination Initiative.
Yes, sir. So the 100 Black Men of America is an organization that was established many years ago with the purposes of mentoring young people and providing opportunities in terms of education and healthcare to young people. My involvement with the 100 Black Men really, I'd say my active involvement with the 100 Black Men of America really started around the time of the pandemic, when there was a lot of information, some correct, some false, some misinterpretation of the data that was going around. And we wanted to reach out to people, talk to them about vaccines, talk to them about other preventative measures. And so we had a number of sessions, very productive sessions with the 100 Black Men and various stakeholders in different parts of the U.S. and different communities, both physicians, stakeholders, as well as community leaders and activists. And this program, this new program, Risk Less, Do More, is just the latest program from the 100 Black Men to try to talk about vaccines and encourage adult vaccines.
Most people associate vaccinations really with children. And I can remember in my early phase of my career, we'd have 60, 70 people in here this time of year. Now, because of vaccines, I haven't seen a meningitis in maybe 10 years, not much pneumonia either, fewer ear infections and the like, and it's all attributable to vaccines. Tell us a little bit about these adult vaccines, the ones that you're talking to the community about.
Yes, sir. That's a great point that you made. Historically, 100, 200 years ago, we had really high infant mortality rates. Most pregnancies, the children didn't live that long. And so vaccines have been a real revolution for children. And as we've gone through the years, we've learned that vaccines also protect adult lives, also provide greater longevity and as well as greater productive life for adults as well. And the three adult vaccines that we've sort of focused on with the 100 Black Men of America have been vaccines that help to protect individuals against respiratory infections. So there's a lot of respiratory viruses that can make a person ill, but there are three that are associated with the most death and the most severe illness. These are influenza, which has been around for a while, COVID, which we all learned about during the pandemic, and the RSV vaccine, which has also been around for a while. And we know it causes, RSV causes significant problems in infants. And we've learned that it causes significant problems in adults with chronic medical conditions and adults over the age of 60.
Now, you have had the opportunity, and well, it's not an opportunity really, to go through the COVID epidemic. And you've had to deal, I'm sure, with the issue of hesitancy. And it's a fairly controversial subject because there's some misunderstandings about it. When hesitancy is looked for in the African American community, it really is not about Tuskegee and distrust of the vaccine necessarily. It's the fact that their interactions with the system itself have been negligent, disrespectful, and ineffective, and insulting in many instances. And so their rage is more against the healthcare system itself, like most Americans now, but not so much about research. How do you, and what methods and techniques do you as an ID guy use to talk about vaccines to kind of overcome some of these arguments?
Absolutely. And I think that's a great point that you made. And I really want to acknowledge the fact that there is still a lot of bias and systemic racism that exists in healthcare. And this does adversely affect and impact African Americans. And so that is definitely true. And in terms of dealing with vaccine hesitancy within the Black community, my strategy has always been active listening, making sure you give time and space for individuals to air their concerns, ask their questions, and voice whatever issues they have with the vaccines or with healthcare in general. And then I always try to answer the questions with the facts, with data. I talk about the benefits of the vaccines, but also I address any concerns that individuals may have in terms of possible side effects of the vaccines. And then my perspective always is that, people are seldom convinced with the first conversation. Sometimes they are, but I think it's really, really important to make oneself accessible to those individuals so that when they have follow-up questions, you answer them. When I'm doing community events, I try to make sure I come back to the community to answer any questions. And I think a key thing also is identifying people in the communities that are trusted individuals who can also serve as messengers as well of the message, be it in church, be it somewhere else, finding individuals who are trusted leaders and working with them to talk to individuals about vaccines.
Our special guest today is Dr. Obi Nadeau. We're talking about a special program with 100 Black men, always at the top of their game. They're trying to impact the community to give you information about the adult vaccines. I think still with the realization that people are dying from these diseases for which we're discussing vaccines, and African Americans disproportionate. We continue our discussion at this time. Dr. Nadeau, tell us a little bit. There aren't that many. First of all, there aren't that many Black allergists around the country. There are probably fewer Black infectious disease specialist. Tell us about your journey into infectious disease and what that's been like.
Yes, sir. So it's been a path for me. I spent most of my life in Alabama. I am Nigerian by background, and I got to live in Nigeria for about 10 years when I was a child. But spent a lot of my life in Alabama, and really sort of dealing with a lot of the let me say, some of the racial issues and that existed in Alabama. And going into medical school, my thought really was to go into primary care and work as a primary care physician in an underserved community in Alabama. And so my initial plan was really primary care. And then during my first year of medical school, I heard a talk. Her name, the lady who gave the talk, is Dr. Pauline Jolly. She ended up being a lifelong mentor of mine. She's now retired, but she's still a very good friend. And she's a Black woman who had been working, looking at HIV in underserved communities. And it really inspired me and really kind of informed me that the HIV epidemic at the time was much worse amongst African Americans and people of African heritage. And that's sort of what inspired me to go into infectious disease. And so, in my day-to-day life and in my practice, I take care of patients living with HIV, but I also answer questions about other infections like respiratory viruses, like we're doing today.